ELI 5. Dentists always tell us to floss or use those tiny interdental brushes along with regular brushing, but you rarely hear anyone strongly recommending mouthwash. Does using mouthwash actually make a noticeable difference? Flossing and brushing both physically remove bacteria and bits of food from the surfaces of your teeth. Toothpaste also has fluoride, which reacts chemically with enamel to make it more resistant to cavities and has some antibacterial effects as well. Mouthwash doesn't remove debris physically, and even though some contain fluoride, it's at much lower concentrations than toothpaste and will dilute away the fluoride in the toothpaste if used immediately after. Mouthwash can be useful for fighting bad breath, especially if used after eating rather than after brushing. In people with soft tissue infections of the mouth, mouthwashes can sometimes be recommended as a part of treatment for that infection. However, because your mouth contains a balance of helpful and harmful bacteria, overuse of mouthwash can disrupt that balance and cause the good bacteria to die off, letting the bad bacteria thrive because it's no longer being kept in check. My recommendation is to use mouthwash after meals if you feel like you have bad breath, or if your dentist specifically recommends it to you. For healthy teeth and gums, focus mainly on brushing and flossing. Source: I am a dentist. Edit: answering some common questions people are asking. If you use mouthwash before brushing your teeth in the evening, it won't dilute the fluoride on your teeth. There is no commercially available mouthwash with a fluoride concentration that won't dilute standard toothpaste. My recommended order for oral care before bed is floss, then brush, and spit, but don't rinse with anything after brushing for at least 30 minutes. If you want to keep mouthwash as part of your oral health routine, do it after flossing and before brushing. Chlorhexidine mouthwash should only be used at the direction of your dentist. It is medication. Follow your dentist's instructions for using it. When choosing a toothpaste, usually the only important ingredient to look for is fluoride. All the common toothpaste brands should have acceptable fluoride concentrations in their standard products. There are lots of fancy toothpastes that advertise extra ingredients, and the only time I would recommend any of them would be one. If you have sensitive teeth, the sensitivity toothpastes, like Sensodyne for example, are generally effective at reducing L sensitivity. Or two, if you hate brushing your teeth but adding a different ingredient motivates you to do it more, i.e. a flavor or texture you like. If my advice is similar to the advice your dentist gave you, it's probably because most dentists have been educated on how to best care for teeth, and we want to help other people keep their mouths healthy.